Yes, we're on.
Yep.
Hey guys. So, this is my beautiful model, Brooke.
Hello.
My name's Shelby. I'm an injector here at Amara. And we are going to be doing a vampire facial live for all of you to see. So if you have any questions, shoot us your questions and we can try to answer them while we go. The first step is to draw blood. So we've got an awesome vein. We are just going to clean it off real good. Nice. Get it all in place here. Beautiful. Make sure she stayed hydrated today. She's not deathly afraid of needles. We treat those people a little bit differently. So, okay, Brett, you ready? Yep. 1, 2, 3, poke. Good. Beautiful. Getting our blood. You guys can kind of zoom in if you want. It's coming out beautifully. Pretty easy, right?
Yeah.
And how much
It doesn't even hurt.
Just a little quick poke.
How much blood do you take?
We're drawing at 22 cc's. We use the high concentration kit from Eclipse. And we draw 22 cc's. We spin it down. I'll kind of show you the process, so we'll get back to that. But for now, it's 22 cc's. Because we want enough to be able to do her neck and her décolleté. You can tell that I've numbed everywhere. We have numbing cream all over her, so we can really take advantage. Beautiful.
Nice double testing.
Yeah, she's good at double testing. You want to hold a little pressure right there? Beautiful. Okay. Alright guys, so there's our tube. So we have about 22 mils, which seems like a lot, but when you're spinning it down and getting real platelet-rich plasma, you need that much volume. Not a lot of places use PRP systems. They say, we have liquid gold, and they really just use normal lab tubes. So it's an important question to ask what system the med spa uses for platelet-rich plasma, because not all of them are great. This gets about 5 to 6 times the normal platelet value of whole blood. And if they're not using a system like this, they're probably only getting like 1.8 to 2 times. So you're not going to get as good a result, if that makes sense. Cool. So, sorry, Brooke, I'm going to have you kind of hold your arm, hold a little bit of pressure there for a sec. We're going to go throw this in the spinner. I'll be right back, okay? You can follow me over here.
Hello.
Unplug my phone. So we have a balance tube here. I need to kind of fill it up to match the same amount. So I'm going to put that in there, and I'm just going to put a little bit of water in here. That's about right. And we hit play. So it's going to spin for 10 minutes. And I usually have the guests numbing while it spins. And we put a second layer on the forehead because the forehead's a sensitive area. So come back in here. How are you feeling?
Feeling great.
Pretty good?
Yeah. Feeling my lips are numb and yeah.
Good.
So do you want to kind of explain what PRP is, what the vampire facial is?
Yeah. So, a lot of people, I think the Kardashians are the ones that made the vampire facial famous. But basically all it is we spin your blood down and we separate the red blood cells and the white blood cells out of the blood through a gel membrane, and I'll show you once the tube's done spinning. But what's left is a platelet-rich plasma. So there's plasma and then there's platelets. So our blood has 6 to 7 different growth factors in it that do a lot of really great things. It's the same stem cell therapy, I guess, similar to what orthopedic surgeons use to inject into joints. So what it does when you inject it into the face, neck, and décolleté is there's a lot of benefits. It actually increases the collagen layer of the skin. So if the studies show that if you get the treatment 3 times, separated by about 30 days, one study did puncture biopsies after, and they could actually see that collagen layer be significantly thicker, which is really cool for people who have thinning skin. We all lose collagen and elastin in our skin as we age. So adding in achieving a thicker layer of collagen means all those little like leathery smile lines that we get, or any leather looking chests, it helps with fine lines, wrinkles, it helps decrease pore sizes, it helps with any hyperpigmentation, redness, helps with acne scarring, which is huge because there's not a lot of treatments that aren't super abrasive for acne scarring. The downtime is pretty minimal, so she'll just be a little bit red tomorrow. You'll leave a little bit red. We have people keep the PRP on their face for 2 to 3 hours, and then we have them gently clean their face and then put on just a gentle moisturizer for the rest of the night. No makeup for 24 hours, but after that, you're good to go. Sometimes people get a little bit dry from PRP, but that's about it. So, do you have any other questions?
I was wondering about the hair restoration. Can you do that on somebody that has had chemo and radiation, like with hair loss?
Yeah.
Sometimes it doesn't come back.
Yeah, that's a good question. So not everyone are good candidates for the PRP injected for hair restoration. Everyone's so different with their types of hair loss. So any like hormonal hair loss, usually I guess there's just a lot of different ones. So usually for hair loss, we want you to come in and have a free consult because we don't want you to waste your money. If it's not something that studies say that it will help you, then we're not going to do it. With a chemo patient, I'm actually not quite sure. We'd have to check, and I'd have to check the literature on that one, and we would want to see what stage they're in.
Mm-hmm.
You know, right post chemo is probably not a good idea. Your tissue's really friable at that point. So, I mean, that's a little bit different than if you're 2 years post, you know. So, I'd usually recommend, hey Kat, Dr. Kat's busting in. I would usually just recommend someone to come in for a free consult. Do you know if people can get hair restoration after chemo? If it helps with that type of hair loss? I'm unsure, so.
It can if the follicles aren't dead. So,
How do you know?
that I don't know. But I am post-chemo, so we'll find out. So, but it's been a long time.
Yeah.
So we'll see.
Yeah, we did Kat today. You can tell she just looks a little bit abused, but she's just got some really fine hair from after having a little baby. How old's your baby, Kat?
9 months.
9 months. So we just kind of did all throughout her mid-head here, and we did down her hairline here on both sides.
This part is strategic to hide the the really thin
Why
part.
don't you tell them how it was, Kat? Was it painful?
No, so we numbed it, and we use a little buzzy when we numb, and then we buffer the lidocaine, which means we make it so it doesn't sting when it's being injected. And so my whole scalp was numb, and so I really didn't feel much of anything. I do have a headache now. We're several hours. We finished it at 10:30 or 11, and so I took some Tylenol for a headache, but I'm totally fine. I'm working. Yeah,
But
so it's been
tell
good.
them, like, how often should they get it?
Oh
When they
yeah,
come
so
back?
for women we usually recommend 3 to 4 sessions a month apart. For men, definitely 4 sessions. And then like a booster kind of every 6 months to a year, because remember that, you know, we can catch you back up, but then you're still aging, so if you have, you know, hormonal hair loss, you're still having that happen, so we kind of need to boost again occasionally. And then when we do like a big check back to see how much of a response you've had is about 6 months, because we got to give that hair time to grow.
And Breck, is there like a desired result that you want from it? Like,
Well,
what?
I'm 40, so I feel like I just am getting older and I have aging skin. And I, in high school, worked at a tanning salon and there was no such thing as sunblock. And years later, I'm now reaping the rewards of all of that fabulous suntan that I had, where I'm paying to have my fine lines removed. And I just kind of want like an overall, my skin texture to feel a little bit better, my pore size to be a little bit smaller. I have some hyperpigmentation right here, and I had some right here. And over the series of chemical pills and microdermabrasion and different things, I feel like it's lightened, but I still feel like I have some of that. So I think I just want like an overall better skin texture.
Yeah, that's a good point too. A lot of the time, you get a really dewy look. You get nice fresh skin. You get that glow. And I didn't mention that, but a couple of the girls here, I'll see if you guys can go track them down. They got microneedling with PRP done last week, and their skin looks so good.
Yeah.
They look phenomenal. You guys, you should see if you can go track them down so you can show them like a post procedure. And there's some really cute
I
stuff
don't
in the
even know who did
boutique.
it.
Brittany Johnston and Lindsay Catano both had it done. Brittany's working today. I don't know if Lindsay is. They both have long red hair.
That one, yeah. I
And
don't
then
think-
Nikki and
like,
Ted-
I just don't want to bombard
Oh,
them. All of a sudden,
okay.
like,
Yep.
them.
Bombard them.
Go bombard them.
Kat will help you go track them down.
What? Yeah, we're gonna say it's Shelby's idea. There's just 3 minutes left on the
Cool.
centrifuge.
Yeah, so just a few minutes and then
Alright.
we'll show you how we separate the blood.
Kat, while we're walking,
Yeah.
can you explain what the deal is that we're doing? with
Yes.
PRP?
So now through the end of April, we are doing friends and family pricing for everyone. This is kind of fun. Oh, I should be like a newscaster. Which is $450 for the vampire facial. But if we do injections, now you guys get to walk backwards. It's an additional $150, and you can prepay for as many as you want. So like you can prepay now, and we can do them whenever. Then back up to normal price is $800 at the end of April.
You want to ask her for...
Here they are now. We're on
Hey.
Facebook Live talking about the vampire facial.
Oh, yeah.
I wanted to know if we could peek in. This almost looks like staged, but
It's really not. We promise.
Us?
what? We look
Well,
fabulous.
because you guys got it done last week,
Yeah.
correct? And
Yeah.
how does it feel now?
I love it. Like, I feel like my the face feels just like really like, I don't know, like tight, smooth.
Did
I
you
don't know.
guys feel dry at all during the
Yeah.
first week or peel? at
Yeah,
all?
mine flaked a little bit.
Okay,
Yeah.
that's
sure.
really normal.
I didn't necessarily get like flaky, but I could definitely feel that there was like an old layer that needed to slough off.
Okay,
So like once that came off, I loved it. Like I felt like the skin underneath it was like super fresh and
awesome. And we did injections on you, right?
Yeah.
Can we show the area?
Yeah.
So she had some acne
yeah,
scarring.
big acne scars.
and like
down
3
here.
days later, she's like, "Oh my gosh, it looks
No,
better
like
than it ever has."
immediately, I felt
Oh,
like
wow.
it was better than ever.
Yeah.
That's awesome. Also, this is totally Shelby's fault and not ours.
Yeah,
so
It's okay.
I just wanted to
We're
make sure.
killing time while the blood is spinning.
That's true. Well, that's awesome. Was it painful at all? Did you feel like it was painful? Because I know you guys get put
It was a
numbing
little
cream.
painful, but like not horribly. Like, you
I
know?
didn't really think so. I thought it was fine.
Yeah.
Some of the other girls thought it was just a little burnier
Yeah.
than regular microneedling. When they
I didn't
had
feel like it
before.
was, like my forehead didn't numb, I feel like as good as like hers.
Okay.
Yeah.
So I felt a little bit more.
Yeah.
But
usually
everywhere else
tender
it was
anyway.
fine.
Yeah. On
Okay.
the very tops of my forehead, it was a little uncomfortable, but it wasn't even a big deal.
Okay.
I have a high pain tolerance, but so I kept telling him to like turn it up. I'm like, if I can get
Be
better results,
aggressive.
it's
Yeah.
not
Right.
hurting, so might as well just turn it up as high as it'll go.
Perfect.
Yeah.
We're good. Well, thanks for
girl.
letting us bombard you. Feel
That
better.
was fun. See you guys later. Okay.
I promise that wasn't staged.
No, it wasn't.
I know.
That was funny though, huh? Oh wait,
Thanks, Keely.
Hi. All right. Well, looks like I have to leave you guys because my next station's here.
Oh, good.
But let
How
me
much
bring
time
this
do you
in
have?
for you because it's just finishing.
Oh, freaky.
So the centrifuge is finishing.
Do you have the little wipe you save this and hook it to there to dry?
Yeah.
Okay.
Oh.
I think it's a different. I mean, they're just trying to.
Yeah, I think it's weird.
How are you feeling? Did she numb your forehead a little bit more?
Yeah, she just put a little bit more numbing on my forehead, so I feel like I'm talking weird because my lips are numb.
No.
You know how when your lips are numb, it's kind of like, But no, other than that, I feel I feel great. My arm where she drew the blood is, I just have like a little mark. I took the pressure off and it's fine.
Ooh, look at that.
Oh, it's a good stuff. So if you look at it, this is the gel membrane I was talking about. Down here are your red blood cells, white blood cells. On top is really, really light yellow. I don't know if you can see the color difference, but on top is platelet poor plasma. The membrane here, this like gel portion, is where a lot of the platelets are sitting right on the top. So our first step is to put gloves on. So we're dealing with blood. So our first step, let me sit down, is to vent it. Now, we're going to draw up the platelet poor plasma off the top, okay? Because that's good, but we want the better stuff, okay? So we got a full 22 cc's. So I'm going to draw out about 4 cc's here. Maybe a touch more. Good. Okay. So that's platelet poor. We'll use that as a mask on the top when we're done. Okay. So since the platelets are sitting right on the top of that little gel portion, I'm going to rock it back and forth 10 times to kind of mix it back in. Draw the platelet-rich plasma out. It's a liquid gold. Every last bit here. Good.
So you're just trying to get as much as you can.
Yep.
Okay.
Well, if you look, there's nothing left in there, just the gel membrane and the red blood cells, which we throw away. No use for that. I like this system because it gets a lot of the white blood cells out, which if you don't have a system that does that, it burns really bad.
Oh.
Yeah, so, yeah, it's good. Actually, okay, so we have a little fulvic elixir I mixed it with. So we ended up with 7 cc's of PRP.
Oh, good.
So we're going to have plenty to microneedle the face, neck, chest, and probably inject some after. So I'm going to put about 4 cc's in here. Actually, we're going to do a little bit more than that. 3.5. Let that little guy go. Okay, Missy, you ready?
I am.
We got her all numb. I'm gonna wipe off the numbing. We use a combination. A lot of people ask what numbing cream we use because it's really good. We use a combination of benzocaine, lidocaine, and tetracaine. Triple threat. It just helps. Does your face feel really tingly?
Mm-hmm.
Did you guys catch any of the girls that had the vampire done?
It looked staged because
It
we went
literally was Brittany
through.
doing Lindsay's hair.
Yeah. We went through the hall and then we opened it and there they were.
They're like
No one
both
else is
there.
around. It's just
No one else.
them.
Looking
Yeah.
beautiful.
I know, and of course they're
You're
just
like, your
flawless.
face looks flawless. What did they say? Did they love it?
Yeah. They talked about how it was like a little bit
Hand me that
like
cartridge.
their skins felt like tighter and like better.
Thicker
And that-
and stronger.
Yeah. And Lindsay talked about how some of her acne scars have already improved.
Nice. Yeah, we were pretty aggressive with them. So Brooke's already had microneedling. It's not her first time. It's not her first rodeo. She knows how it goes. I mean, it doesn't hurt really bad, but it doesn't, like, feel good by any means. Let's be real, huh? So I'm going to start on the forehead. And we're going to do 0.5. Good. Alright. So I'm just spreading a little bit of PRP magic on her forehead. I'm going to do a pass and see how that feels. Does that feel okay?
Yeah.
One to 10, where you at, pain wise?
I would say like a 3.
Okay, cool. Well, we're getting a good response already, so let's stick with that.
There's kind of a misconception that, like, the vampire facial, there's a lot of blood included.
Yeah, we'll get there. It usually, this is a good response for a first pass. She's starting to get a little bit of pinpoint bleeding. I usually start a little bit lighter for the first pass. We're going to turn it up a little bit because she can tolerate it. She's only at about a 3, pain-wise, she said. And then you kind of end up blending that blood in a touch. How you doing, Britt?
Great.
Good. If it gets too intense, let me know. Okay. Good. Yeah, you're getting a good response back. You're looking good.
Great.
Good. We usually do about 3 passes in each area, just in different directions to make sure we got it really good. And do a little diagonal pass here. She's all over that camera.
I know. I'm getting
Look
all
at
the
you,
angles.
multitasking. Cool. So that looks really good. If you guys want to kind of zoom in on that, she looks awesome. I'm really happy with how that's looking. I'm going to return your head to the right, Brooke. Good. Then just do the temple area here.
And you said you do 3 different passes in different directions.
Yep. You got it. Good. How you doing?
Great.
It's the perfect model here. I'm gonna turn it up.
You're getting a lot of emojis with hard eyes.
Ooh. Oh, hello everybody.
Jessica Larson asked, do you feel
Turn to the
anything,
left.
Brooke?
I do feel.
the left.
Oh, sorry.
No, it's okay.
I do feel a little bit, but I feel like it's more just really the sound that's kind of annoying. Of
Yeah, the
pen.
sound is
And I
annoying.
don't like. It's just kind of like a weird sound. It doesn't hurt. It just feels like someone's poking you a little bit, but it's not terrible. And I think it's the sound of the pen that makes it worse.
That's true.
That's good feedback. I think it is annoying. That's okay.
But I think that's the only thing that I would say. I'm not in
the
pain.
needles going back and forth and back and forth. They just go so fast because you don't want them to snag the skin.
Yeah.
Right? Okay, I'm just going to right between your brows here, and then we're going to move down your nose.
And what are the parts that are more like the most sensitive when you're?
I'd say the forehead's probably the most sensitive. What do you think, Brett?
I definitely think that the forehead hurts the worst. Like, I can't even feel that.
You can't feel the nose?
Some people experience like tickling in the nose.
Yeah,
right?
sometimes it makes you feel like you want to sneeze.
Like that right there.
Sorry.
Tickling.
Well, a lot of people get really big pores and clogged pores around their nose, so we're just going to get your nose really, really good.
I can't even feel that one.
Good.
So, oh gosh. Spins, points, bow.
Do you have a question?
Oh. Spin.
Okay, so...
Spin,
your
so,
upper lips
inspo.
together.
I'm like
Spin.
shaking because
You what?
Spinspo, inspo.
Inspo.
Inspo, inspo is their name. Sorry, that took me a minute. They asked how much does this cost, and they said amazing.
Oh yeah, so microneedling with PRP Vampire Facial is normally $800. As you can see, it's quite the process. Thanks, Brett. Sorry, upper lip's a little tender, so good.
Oh, you got a nice blood mustache there.
Do it again for me. Just 2 more passes. So normally it's $800, and right now we have a special for $450 until May 1st per treatment, which is a killer deal. We just kind of want everyone to be able to experience it. It's just an awesome treatment. So, sorry, Breck, I know you're dying. Good.
That one hurt worse
Okay.
than my forehead even.
Well, let me tell you, that blood mustache looks real good.
Yeah, you're looking good, girl. All right, so turn your head and look to your right.
Oh, my right.
Yeah, you're right. Actually, sorry, stay midline. I'm going to do your chin first. I'm just going to stay midline. They got me all distracted over here. So you can prepay for as many treatments that you want at $450. So usually I recommend at least 3 treatments for people. Can you tighten your, yeah, perfect. So prepay for at least 3 treatments and you can get them all for $450 each, which is awesome.
So, Spinspo Inspo also asked, does it leave your face scabby from all the cuts / bleeding?
No, it actually doesn't. So she just bled a little bit and I'm kind of like rubbing it in. We just kind of rub it in. It's just micro channels, so it's just micro bleeding. You won't have any scabbing. You'll feel a little bit dry. Sorry, Breck, I know you're dying. But it doesn't get scabbed at all. No, you're just a little bit red. Good. Just one more pass, too, okay? You're doing good. Do you ever get, like, blackheads right here?
Mm-hmm.
Okay, I'm going to get your chin really good down. I'm going to taper it down a little bit. Okay. You got the cutest little chin.
Brooke is just beautiful.
I know. Perfect model. So yeah, that's a really, really good response to it. You'll see that as we go. I'm going to rub a little bit more PRP in as we kind of go along. And you'll see what it looks like at the end. Okay, now I'm going to have you turn to your right. Good.
The thing that hurt the worst so far has been the lip.
The lip?
Mm-hmm.
Yeah.
And I would say it was like probably like a 7.
There's a lot of little nerves around our lips, but it feels so good to kiss. So people ask if they can do this if they have filler. Totally. Brooke, we've done Brooke's cheeks and her tear troughs and her lips, so you can totally do it with filler.
Which we still have on the Facebook Live.
What's that?
We have on our Facebook as
Yeah,
one of the
which
lives
is still actually, she's such a great model. We're using her again. I'm just going to taper down your neck a little bit here.
You can find that video on our Facebook page or on our YouTube channel.
When we did her cheek and
Cheeks and
tear
tear
trough filler, yeah. Alright, so I'm going to turn it up for a cheek.
You have a question. What is this called?
This is called microneedling with PRP. So, hence I don't know, people call it the vampire facial just because of the blood and stuff. But we're microneedling and we're using her own PRP, platelet-rich plasma. Kind of digging it in the channels here. PRP also helps with dark circles, so I'm getting pretty kind of close to her eye here.